Over the past 20 years, a quiet revolution has been taking place in services for older people in Belfast. Many of the traditional services have gradually been redesigned and restructured to meet the needs and wishes of older people and their families. Today's health and social care decisions are part of that continuum, part of that development and part of that responsibility. Decisions and developments are never easy, nor should they be. They can affect the lives of patients, clients, families, carers and staff. They can shape the future of services and lives for many years to come. Many of the service principles now enshrined in Transforming Your Care were developed in Belfast. They were introduced to replace outdated services, allow people the choice to remain in their own home, and support a better quality of life. The foundations laid by these decisions have enabled many of the services we now take for granted to be introduced over the last 10 years. Across the city, integrated teams of skilled occupational therapists, social workers, social care staff and care managers are working alongside GPs to ensure people have their health and care needs, including palliative and end-of-life care, met in their own homes. These are just some of the developments that have been achieved in recent years. All of them are based on the premise that, given the choice, most people would prefer to remain in their own home for as long as possible. These services have been designed to make that a reality for older people throughout this city. Old, inappropriate and in many cases institutionalised care provision has been gradually replaced by services which recognise people's wishes, maintain and develop their strengths, focus on continued support and assist independence rather than dependence. 10 years ago and more, there were no viable alternatives to residential care for many people. The quiet revolution has changed that. The extensive range of services and support that are required to ensure older people are supported in the community have gradually been designed, implemented and developed. This ongoing project now provides a range of services that could not have been imagined just a couple of decades ago. The Belfast of today offers older people, their families and their carers the choice of a broad range of services and support to help them remain active and in their own home or community for as long as possible. These services and this approach not only provide a viable alternative to institutional care, but also help older people to return home earlier from hospital, support them on their discharge, and avoid admission in the first instance. Integrated care teams. Based in the Trust's 8 health and wellbeing centres, the integrated care teams coordinate and bring together health and care professionals, including care managers, occupational therapists, clinical support teams, social workers, and district nursing staff, to provide a comprehensive range of skills at one community-based location. Intensive home care services. One of the original and groundbreaking services of the quiet revolution in older people's services, it provides care for frail older people with complex needs in their own home. Without this service, many people would have no alternative but to leave their home and consider institutional care. Community nursing teams. The traditional district nursing service has been transformed to ensure rapid assessment and short-term treatment in people's own homes by highly skilled core teams over the 24-hour period. The intensive community nursing teams are further supported by specialist teams caring for diabetes, respiratory conditions, oncology and heart failure. Community stroke team. Rehabilitation following a stroke used to mean a long stay in hospital while capacity was recovered. Community stroke teams now provide individually tailored and goal-focused treatment plans at home. They also allow for much earlier discharge from hospital and prove more effective than hospital-based rehabilitation. Community-based rehabilitation. Evidence shows that given the right support, people rehabilitate much more effectively in their own home. Community-based rehabilitation services provide that option and deliver that service in an environment where people are more comfortable, more confident, and more receptive, their own home. Reablement services. The road to recovery from an illness or a personal crisis often means individuals regaining their confidence and relearning their daily living skills. Staff from the Trust's reablement services provide the skilled assessment that identifies an individual's needs and abilities. What follows may be a period of intensive help and support, the introduction of home aids or help with social skills. The outcomes rebuild self-reliance and reduce and postpone the need for residential or long-term domiciliary care. Urgent care pathways. Led by a community consultant geriatrician, the Urgent Care Pathways is a network of nursing, therapy and social care services. This new development has been recently piloted in Belfast. Where appropriate, it offers older people the option to receive specialist acute care and crisis support at home. This extends the choices available to older people and reduces further reliance on hospital-based services. Domiciliary care. Providing care and support around the clock every day of every year, it allows older people with complex needs to be cared for in their own homes. There are 6,245 home care packages in place in the Belfast area. This means that the vast majority of older people in receipt of social care services are now cared for at home. Intermediate care services. More than 2,000 frail older people avail of the Trust's intermediate care services each year. The 250 intermediate care places provide rehabilitation, short-term spells in nursing homes, secure improved outcomes, and reduce the need for hospital-based services. Support for carers. Looking after the needs of carers is an essential part of providing care for older people. A range of support services for carers has been developed, which includes training, therapeutic activities, flexible breaks and respite at home or in a residential setting. Direct payments. Enabling people to make their own care arrangements through the use of direct payments provides greater choice and control. People can make their own decisions about how their care is delivered and achieve greater flexibility in how their services are provided. This initiative is set to be developed further with personal budgets for service users. Development of mental health services for older people. A successful multidisciplinary inpatient and outreach service has now replaced the 84 long-stay dementia beds at Knockbracken. The average length of stay for patients undergoing assessment is now 25 weeks. It used to be a lifetime. Supported housing options for people with dementia. The concept of supported housing for people with dementia challenges the dominant belief that residential and or nursing homes are the only viable options for long-term care. Schemes at Mullen Mews and Sydenham Court enable people with dementia to lead full, active and meaningful lives in their community. A third scheme has now opened at Hemsworth Court in North Belfast. Among the essential elements of this approach are independence, safety, family involvement, choice, control and dignity, all of which underpin a genuine and measurable quality of life. These schemes, specifically designed for people with dementia, provide the option of a tenancy to individuals or couples, or the choice of small group living. Improved adult safeguarding arrangements. The Trust's Gateway team provides a single point of contact for people and professionals with any concerns about the treatment of an older person. The team is also authorised to conduct investigations into allegations of abuse against an older person and, where necessary, to take action to protect them. The safeguarding team also works on raising awareness about the need for vigilance and recognising the early signs of potential abuse. So how do the people who use these services feel about them, and what do the people who provide them or work in partnership with the Trust have to say?
My mum used to live in her own house and she was put into respite. She was in a residential care. It was okay in its own right, but you know, all her meals was cooked for her. She just sat in the wee room, sort of, basically everything was done for her. Where in Sydenham Court, you're encouraged more to do more stuff for your stuff. You know, my mum does her own cooking, her own washing, her own cleaning. She has her own suite. She really loves it here. The staff's on 24 hours. Anything happens, the staff is always a staff member on hand, which makes me feel more secure as well.
It's also very rewarding too when you see the tenants out and about, just normal day-to-day living. Maybe popping into the butcher's for a wee roast for Sunday, or going for the newspaper and having a wee banter with the fruit and veg man. And it's great just to see the social interaction and the well-being they get from these activities.
I see big changes in my mum. My mum, she would have been afraid to go out on her own, but now she's confident and she goes around the Belmont Road. She does her own shopping. She handles her own money and all now, you know, but before she couldn't do that. Her medication, the staff administer her medication for her, and she really loves it here.
I think the changes that have taken place over the last 10, 15 years reflect the ageing demographic, in that we have now people who are what would be classed as very old, living very well in community, and they are supported by a range of services which probably started around the early 1990s with the Cairn Community policy and strategy. And that was very much about making sure that people had opportunities and choices to live at home. And that's now reflected in today's service arena, whereby we're putting services in which keep people with very complex health conditions at home for longer, which you would not perhaps have had available, be it 10, 15 years ago.
A lot of what we hear from older people is if given the choice, and I think that's the important thing, it is about choice. One size isn't going to fit everyone, but many older people, if they have the choice, would like to stay in their own homes for as long as possible. There's no one agency who can make that happen, so it requires a range of supports, and I think that's where our service complements what else is out there. We can't do everything, but if we can't provide a service, part of the key aspect of what we do is signpost to others who can.
Direct payments for us changed the way mum and dad were cared for. To begin with, we had no idea as a family what type of care we required, what services was out there. So initially we had to speak to the social worker and explain what was available to us. And they gave us two options. One was direct payments and the other one was domiciliary care. Once they explained it in detail to us, what direct payments was about, it was a no-brainer. That's what we were going for. Domiciliary care to us, as much as it's a good service, it wasn't the service as a family that we required or needed. Direct payments gave us the freedom to adapt a care package that suited us as a family. All families are different, and direct payments definitely worked for us.
We recognise that in responding to the multifaceted needs of older people, providing good quality accommodation and support to them is one part of that, but we wouldn't be doing our job well if we didn't recognise that we need to work in partnership with other agencies, that we can't meet the needs of older people without talking to everyone else. Indeed, it's not that thing. So the focus of our work over the last 5 or 10 years is much more focused on how we develop partnerships, how we maintain partnerships with a range of agencies on the ground, through to local community groups who represent older people, through to housing associations, and to various elements of the health and social care sector. They've gone through a big organisation at the moment, and transforming your care is a buzzword in their sector. And at the heart of transforming your care is this idea of home as the hub. And for us, that's critically important. It places housing at the centre of the community and centre of the life of an individual. So for us, it's critically important that we build those partnerships and we continue to work with those partnerships.
Overall, I would really recommend supported housing. I really enjoy working here, and I wouldn't hesitate for my own mother to come in. I think it's the best we'll have out there. Providing you have the right staff and the right environment, people with dementia can now lead long, happy, fulfilling lives.
Yeah, I think transforming your care has got the direction right, and I think more resources need to be put into supporting older people in their own homes. For example, one area we see a real demand and need for is for befriending, but equally I could name cleaning services, shopping services. It's that little bit of help that enables people to stay in their own homes. It could be small and practical support, so I think that's an area that needs looked at. But again, it's back to choice. One size doesn't fit all, but many older people, when given the choice, would like to stay in their own homes for as long as possible.
Services for older people are changing, and in our view they're changing for the better, provided that older people are involved in that change and have choices which are about person-centred care based in their own home, with a range of opportunities for early preventative work in terms of that little bit that makes a difference at home, and also about the choices of the people who can support them in care as perhaps their condition changes. So it is a changing environment. It will involve a lot more technology. We will become more in tune with telecare, telehealth, and that can play a vital role, particularly for those who are in need of more complex support that once was in hospital but now is very much at home.
I think community-based services for elderly people are constantly changing, and the impetus, and certainly with TYC now that we're working with, the impetus is to provide care closer to home, and we really are seeing changes around that, mainly in terms of reablement schemes and about support for elderly folk in their own homes, and also about earlier discharge as well, and some of the intermediate care facilities which are helping get people back out of a hospital environment and back closer to their own home and into their own community.
I mean, the community urgent care team is designed to provide an alternative for older people to hospital care. Some people need to be in hospital, but I think most of us would prefer to be at home if possible. And now we can treat chest infections, falls, urine infections, confusion and many other conditions successfully at home. In fact, people often prefer it because you eat better, you sleep better, you're much less likely to become confused in your own bed and in your own familiar environment.
Yeah, I think older person services are heading in the right direction. I think they are becoming much more of a community-based model. We saw that change in the past, and maybe 5 or 10 years ago there was maybe more of a community focus, and we're suddenly starting to see an increase in community service again, and that is about combining primary and secondary care, working together and trying to provide the best possible care with the aim of keeping people at home when possible.
We know that delivering community services to older people at home is successful. We have research to show that, and to show that actually people do better. They eat better, they drink better. At 6 months their mortality levels are better if they're living at home, and that they're less confused. But actually more important than all of that is we know from the research is that people prefer it. So patients and their carers are generally more satisfied. But I think, every patient's different, and that's part of delivering individual care for each person. So when we're out in the house, it's not about what we do for everybody, it's about what we do for that one person, and it's having a talk to them, and every situation's different. So for some people it's the right thing to be in hospital, but for the majority of people we can support them to be at home. And it's about ensuring that they have the specialist care. Just because you're at home, you're not getting a second-class service, you're still seeing the consultant, the physiotherapist, the occupational therapist, the nurses, the social workers, the psychiatric team, everybody who you would have seen in hospital who are specialists in older people, but you get to see them at home, which has got great benefit.
After 16 days in hospital, I was keen to get home, and essentially I couldn't have managed it without the support of the team. What I had was wonderful help, with the helpers really getting me dressed and washed in the morning and to bed. The second bit, the occupational therapist, in terms of equipment and advice as to how to handle things in the home. And the third bit was the physio, where again, you've got to work very hard at the physio to get back on your feet, so that I had the help from the team, but equally, I know that if I didn't put work into it myself, it wasn't going to happen. So we've moved on, making good progress, but very grateful to the support and help of the team.
As the population of Belfast and beyond grows older, our services need to keep pace. They need to be developed ahead of demand. They need to be the best that they can be. The quiet revolution has placed us well for the future, because in changing services, it has also started to change cultures. It is changing the way we understand services for older people, it has changed practice, and it is changing thinking.